If I know the characteristics of these plasma proteins, albumin has got certain characteristics, and because of these characteristics, it will perform certain functions. Globulin, there are different kinds of globulin. Alpha globulin, beta globulin, gamma globulin, those are again classified. Globulins are actually antibodies. And these antibodies are actually immunoglobulins. We know immunoglobulins are very important because they fight against the pathogens, toxins, and how they fight. For that, different fighting agents are there in our blood. So, what is their mode of action? So, that will be discussed in detail when we will be explaining you about the immunity. Okay, in that class I will be detailing it out. So now the very first function, very important function of plasma protein is, can anybody tell? Can anybody tell? A very important function of plasma protein? Lot of functions are there. Now you will be understanding. One important function is blood plasma protein maintains osmotic pressure. Osmotic pressure. See, now what will happen? Osmotic pressure, osmosis. Lot of students must be having doubts. What is osmosis? What is osmotic pressure? If I start taking this class, then there will be problem. I will not be able to finish. But you have to learn what is osmosis. Otherwise, this function of plasma you will not follow. Because its function is to maintain osmotic pressure. And if the osmotic pressure of blood is not maintained by plasma proteins, we will be facing different consequences. Like there will be formation of edema. We have seen edematous patient. So there will be formation of edema. You will be learning, wow, what is the role of albumin in this mechanism, in the mechanism of formation of edema, development of edema, how it is developed. So if for that reason you have to know the osmotic pressure. You will find slight variation of osmotic pressure of our plasma, of our blood. What happens? Okay? Can blood come in direct contact with this tissue, cell? Is it possible? Blood, can it come in direct contact with the cells? Directly? What is there outside the cell? A fluid. Outside the cell, there is a fluid. What is this fluid? Extracellular fluid or interstitial fluid. So blood vessels, say artery. So it will be divided while going to the periphery. It will be divided, it will be producing a lot of branches, and ultimately it will produce capillaries. So in the capillary wall, you don't know how this capillary is made up. Actually, single layer of cells, okay, and they are not tightly one another. There is some gap. There is some gap to facilitate filtration. filtration. So what will be there? Suppose this is the capillary. The cells are, these epithelial cells are called endothelial cells. These cells are called endothelial cells. So outside the capillary, inside the capillary, what is there? Blood and plasma is also there. Plasma protein is there within the plasma. So outside the cell, there is interstitial fluid or extracellular fluid. Now this ECF or interstitial fluid is in direct contact with the cells. So what will be there? If anything is needed by the cell, so the cell will be getting it from the blood. So from blood goes, say for example, glucose. So from the blood, it has to enter into the ECF first. Then from the then they will enter into the cell. Similarly, some excretory product has to remove from the cell. So from the cell, it will come to the ECF, from the ECF to the plasma. This will happen in the venous end. So in capillary, there will be, in capillary, you will find one is arterial end, then the part of artery is finished, then starts venous end. So arterial end, venous end are here are the cells. You understood? Okay. Now plasma protein, colloidal, maintenance of colloidal osmotic pressure. Then again, if I ask you what is colloid, what do you mean by colloid? Can you answer? I cannot explain it now. Then what you have to do? You have to clear what is colloid, what do you mean by colloid? And proteins are actually colloid. So plasma, proteins are proteins. So definitely they are colloid. Colloid remains in suspension. Always remain in suspension. They cannot pass through semi-permeable membrane. So these colloids cannot pass through the capillary wall under normal conditions since their size is big. Like RBCs, WBCs, platelets, they cannot pass from through the capillary wall because their size is bigger, but the pore size is smaller. Only depending on the size of the pores in between the endothelial cells, those things will be passing whose size is lesser than this. See, one of the unique thing you have to answer, I am giving you the question. Diameter of the capillary is lesser than the size of the RBC. Then how this RBC travel through? You have to answer in the next class. What is the question? What is the question I told? I asked. Diameter of the capillary is lesser than the size of the diameter of the RBC. Then how they travel through they has to travel. Otherwise, who will supply the oxygen? RBCs will be supplying oxygen. Who will bring carbon dioxide? These RBCs will be bringing carbon dioxide. So then how they will pass? But they pass through capillary. But how? That is, you have to answer me in my next class. Okay. The colloids, since the colloids, plasma proteins are colloids, they will be exerting certain pressure, and this is called osmotic pressure. And the uniqueness of this osmotic pressure is they always try to retain some water with those molecules. Always try to contain some water. But if you have a tube through which water is passing, the pipe, water pipe. So if there is any leakage, any pore in the wall of the pipe, what will happen? Water is passing. Water will come out. Why this water comes out? it tries to come out, there is a pressure on the wall of the vessel. So this pressure we call hydrostatic pressure. So the blood capillaries, there is plasma, contains water, 91% plasma water. So this will also try to exert pressure, and if there is any pore, then this water will come out. So it is because of hydrostatic pressure. Now see, one force of blood is trying to hold the water, and another pressure is trying to push the water. The one will facilitate filtration, and other one, osmotic pressure, will facilitate absorption. And these are two opposing forces. We call it Stirling forces. We call it Stirling forces. And depending on these forces, this force will determine whether in the capillary net filtration there will be net filtration or a net absorption. Now you see, you can assume, if hydrostatic pressure, which is 35 millimeter of mercury, okay, whereas colloidal osmotic pressure is 25, who is powerful? Who is powerful? Osmotic pressure is 25. It is trying to hold the water within the blood vessel, within the capillary. But another pressure, hydrostatic pressure, it is trying to push the liquid. Now what will happen? Whether there will be absorption or filtration. What will happen? Water will come out. Water not alone with some solutes which are essential for the cells. Okay, so these will come out. Means there will be filtration. Now certain amount of fluid has come out of the vessel, and if it starts accumulating, what will happen to your body? And one time there will not be any water in the blood, and all water coming into the tissue spaces, and this phenomenon is called edema. Okay. Now actually it doesn't happen. There is no edema in your body, in my body. That means the amount of water coming out, same amount of water is coming back. How? How? Read it. At arterial end of capillaries, what happens? Hydrostatic pressure is greater than osmotic pressure. So since it is greater, it cannot hold all the plasma. It is holding some, but force is higher. So because of that pressure, net filtration pressure will be the difference between the two. Suppose, as I said, suppose hydrostatic pressure is 35 and osmotic pressure is 25. So what is the difference? 10 millimeter mercury. So because of 10 millimeter mercury positive pressure, what will come out? Fluid will come out into the interstitial fluid. Okay. Now think about what happens in venous end. What happens in venous end? The reverse. Since water has come out of the vessel, so hydrostatic pressure will be reduced at the venous end. Blood has traveled to that part, so it will be reduced. Now it is, instead of 35, it is 15 now. Now it is 15. But osmotic pressure in there is same because proteins are not coming out. It is remaining same. Now who is powerful? Which one is powerful now? Hydrostatic state at the venous end. Osmotic pressure is more powerful. So now what will happen? It will draw fluid from extracellular space into the capillary again. Now how much will come out and how much will re-enter and will enter, it depends on what is the difference? If it is difference at the arterial end is 10 millimeter mercury and at the venous end also minus 10 millimeter mercury, then the amount of fluid that is coming out will be equal to, the pressure is same, net filtration pressure is same, effective filtration pressure is same. So the amount of fluid coming out will be equal to the amount of absorption. So no fluid will be accumulated in my body. It is happening in your body. Now it may happen. What happened? Arterial end pressure is, effective filtration pressure is more. Say 12. Effective means this minus this. Yeah, it is how much? 12. But at the venous end it is minus 10. So at the arterial end it is higher. So because of this effective filtration, higher effective filtration pressure, there will be some accumulation of fluid. The amount will not be, amount of fluid filtered, amount of fluid absorbed is not same. That is, excess fluid will be there in the tissue fluid. Now what happens? What will happen to it? Normally, it may happen. Normally. Now what will happen? See, at the arterial end, HP means hydrostatic pressure. What is the value? 37. And osmotic pressure, COP, colloidal osmotic pressure is 25. Suppose it is 25. Then what is the difference? 37 minus 25, it is 12 millimeter of mercury. So because of this, effective filtration pressure is 12. So because of that, certain amount of fluid will be filtered. But at the venous end, osmotic pressure is same, 25. But here, hydrostatic pressure is 15. What is the difference? 10. Now they see effective, there is filtration difference in effective filtration pressure. So there will be more filtration but less absorption. Because of this, there will be accumulation of some fluid. So this will continue. If it continues, there will be edema. But it doesn't continue normally. Why? Because there is another system, like circulatory system, there is cardiovascular system, vascular system, there is another system that carries fluid again to the blood. What is this? This. Sorry. These are lymphatic channels. They will collect normally they will collect this fluid and through their vessel they will drain it in subclavicular vein. So means this blood, so again this amount extra fluid will be coming back to your circulation. As a result, no fluid accumulation is there. Now think, there is a blockage. Now think, there is a blockage here. Blockage of what? Lymphatic channels. So because of blockage of the channels, it happens in different diseases. Huh? Okay. So what will happen? This extra fluid will not be drawn back to the circulation. So they will be accumulated. So you will suffer edema. Similarly, what happens? Now you calculate. What happens? My liver is going, losing its function. So it is now unable to produce plasma protein, particularly albumin and globulins, fibrinogens. So as a result, plasma protein level will be reduced. As a consequence, the osmotic pressure will also be reduced. Now, instead of 25 millimeter of mercury, my osmotic pressure is 20. Now what will happen? Calculate. Other things are same. Hydrostatic pressure is same. Now what will happen? what will happen to the net? Whether there will, what will be the effective filtration pressure at the arterial end and at the venous end? Calculate. By this we will be learning what will happen to you, to the patient's body, if osmotic pressure is reduced, is less than normal. 37 minus 20, but 35 minus 20. So 15 is the net effective filtration pressure, and the venous end 20 and 15. Hydrostatic pressure is there, constant, but osmotic pressure is 20. Both the end, osmotic pressure is constant. Here, in this case, at the arterial end is 20, in the venous end also 20. Now, what is the effective filtration pressure at both ends?
What is the hydrostatic pressure in venous end?
15.
5.
5 mm means less fluid will be drawn, more fluid will be accumulated. Obviously, there will be edema. See the consequence. Why? If liver goes abnormal, for example, cirrhosis of liver, liver is shrunk, all the hepatocytes are diminishing, its place is occupied by fibrotic cells, fibrous cells. So this liver is undergoing fibrosis. So it is now unable to produce albumin, unable to produce fibrinogen. So since the fibrinogens are not producing, so there will be some clotting, disturbance in clotting mechanism. So you have to correlate in that way. So you must know. So now you can find what is the importance of slight variation of osmotic pressure because of change in plasma protein. What happens? But your capillary pressure also, capillary hydrostatic pressure may also change. What may happen? Now you can understand. So these are very important for exchange of fluid in between cell and blood. Very important. So you have to understand this clearly. And these are the, so what may happen, if this edema can happen, there are two ways. If lymphatic channel is blocked or hydrostatic pressure is increased but osmotic pressure is decreased, it may happen. Or another thing can happen. Normally we expect the wall of the capillary, there are space in between the endothelial cells. Means this is maintaining the permeability of the capillary wall. There are some conditions when there is inflammation, its permeability changed. Means which were not supposed to come, they will come out. They will come out in the tissue space. And there will be more fluid coming, easy passage. So there will be accumulation of fluid. Say in case of external skin inflammation, you can see this. Some, okay. Now it is clear to you. Role of plasma proteins in osmotic pressure, very important for maintaining body functions, maintaining exchange of substances between the cells and plasma. Okay. Next important function of plasma protein are viscosity. As I said, viscosity, you have to know what is viscosity. Means it is viscosity, it is either it is lighter than water or thicker than water. Plasma is thicker than water, nearly 4 to 5 times thicker. I gave the unit 4 to 5 milli
centipoise.
centipoise. Another centipoise, 4 to 5 centipoise. Another unit is there, Pascal. So you study what viscosity, what are the factors that affect viscosity. So blood viscosity is maintained by plasma proteins and the cells. Mainly since cellular content means RBC content is relatively highest. So this RBCs and the plasma proteins, particularly those plasma proteins, albumin, it has got little role. Though its amount is highest relative to globulins and fibrinogen. Its amount is higher, but their size is small. Their molecular weight is albumin. Molecular weight is 66,000. Whereas molecular weight of fibrinogen 256 and molecular weight of globulin higher than albumin. Okay, 150 something. Viscosity, the size of the depends on size of the molecules. Since the atomic weight, molecular weight is highest in fibrinogen, they will exert more viscosity. Globulin will exert more viscosity. Okay, then albumin. RBC will exert actually more than 50% of total viscosity is exerted by RBC, near about 55 to 60% of viscosity is exerted by RBCs and the rest is exerted by the plasma proteins, that too by fibrinogen and globulin. Now understood the importance, if the contents of fibrinogen and contents of RBC goes high, what will happen? Viscosity will be increased. If viscosity is increased, what will happen? While passing through the vessel, it will create friction on the wall and friction to each other. As a result, flow will be reduced. So it is an obstruction, resistance to flow. Flow will be reduced. Okay. So when there is reduced flow, the blood will be retained within the vessel, it cannot go away. As a result, blood pressure will be increased. So, can you relate it now? If there is any change in viscosity, what happens to flow? What happens to blood pressure? Because of resistance. Low content, less friction, easy flow. Understood? So this should be clear in your mind. Already told? Transport functions. While in our last class, individually, I told what is the function of albumin. See, there are a lot of functions of albumin. See, what are these functions? Albumin binds to and transport various substances through our body. Plasma protein. See, albumin, what does it do? To transport ions like calcium, copper, and drugs like penicillin. It transport gases, pigments, etc. Pre-albumin transports vitamin T3, T4, capital letter, this is brief, T3, T4 and vitamin A. Okay, so lipoprotein, they transport, it has got various functions, lipoproteins. One is lipid transportation of lipids and fat-soluble vitamins. See, doctors, when a cardiac patient or obese patient goes to a doctor, he immediately suggests lipid profile. And when the report comes, it says what is the cholesterol level, what is the triglyceride level, what is the level of HDL cholesterol, LDL cholesterol, VLDL cholesterol, because they transport fats. Some transports fat from our GI tract to liver, from liver to the periphery adipose tissues, and help in depositing there. LDL cholesterol, they deposit fat, triglyceride, fatty acids from liver to the periphery in the adipose tissue. If possible, if amount is high, on the wall of the blood vessels, means in the endothelial cells. So if these are deposited in the endothelial cells, these fats are deposited, cholesterol are deposited in the endothelial cells. Blood vessel, this is the innermost layer, and there is another layer here. There is another 3 layers. Outer layer, tunica adventitia, tunica media. Tunica media is made of muscles, smooth muscles. So they are able to contract. If they contract, blood vessel becomes narrower. When they relax, the lumen gets wider. So by that, we can control our blood pressure, flow of blood. When these blood vessels are, muscles are constricted, the diameter will be reduced. So this will be obstructed, flow obstruction. So there will be increase in blood pressure. When we take drug, so they will relax this muscle. The lumen will be wider. So now easily blood can pass through. This is the mechanism. There are other mechanisms too, by controlling the heart. Okay, by controlling the stroke volume, by controlling the cardiac output. That way we can measure. So what happens? This LDL cholesterol, LDL, they deposit cholesterol triglyceride here in these cells. So this cells becomes thick. Now what is happening to the lumen? Narrowed. And not only this, actually the inner endothelium is very smooth. Why smooth? Otherwise the platelets, they are very fragile. While traveling, they will be broken. And if this is broken, then difficulty starts. When blood will be clotted. So that's why we maintain smoothness of the inner surface. So now, because of deposition of this, the lumen will be narrower and there will not be any smoothness. Now what will happen? While traveling, the platelets can be broken, and process of initiation of coagulation, clumping of platelets may start. So it may be blocked. Blockage of coronary blood vessels. Blockage may be there in the cerebrum, so there will be stroke, heart attack. So that's why I want to know what is the LDL cholesterol level. Because they are doing this thing nuisance. And HDL cholesterol, they are good cholesterol. They bring it back to liver. So they are helpful. They prevent atherosclerosis. The process is called atherosclerosis. So lipoproteins transport lipids and fat-soluble vitamins. Haptoglobulin, type of globulin transports free hemoglobin. Hemoglobin always retained within the RBC. How can it come to plasma? Another question to you. Question number 2. What would have happened? What would have happened if hemoglobin, instead of be within RBC area, they would have present in plasma? In that case, what would happen? Like plasma proteins, hemoglobin is this 14 gram of 50 per 100 ml is kept within the plasma. What may happen? What may be the consequence? You have to give me the answer. So, there is TBG, thyroxine binding here, T3, T4, triiodothyronine, thyroxine are formed, and they are needed by my both somatic cells. So, how they will be transported? The albumin they will bind with this globulin, thyroxine binding protein. They will bind it and transport it to the tissues. So these are actually plasma proteins. Similarly, ceruplasmin it carries copper, and if there is production of ceruplasmin is reduced, then there is a disease called Wilson disease. So these are of clinical significance. Plasma proteins acts as buffer. Plasma proteins, albumin, globulin, every constituent of plasma protein, they will participate in buffering the excess hydrogen ion or alkali. What happens? Plasma proteins, all the proteins remain as HPR and PR negative, because all proteins are having amino group or carboxylic group. Carboxylic group, it can donate its hydrogen ion. When the solution blood becomes alkaline, it will donate hydrogen ion. So this will stabilize the alkali. It will stabilize the base. But when you add some acid through your food, or your tissues are producing, say, lactic acid, so producing acidic substances and putting it in plasma, now that one will also be neutralized. How? This amino group will accept those hydrogen ion and neutralize it. The NH2 group will become NH3 plus. NH3 plus. In that way, all the plasma protein can participate in buffering, maintaining acid-base balance of the blood, because we know blood has to maintain it at a particular pH. What is that? 7.4. Slightly alkaline. 7 is neutral, so 7 is slightly alkaline. Why it is 7.4? Why we try to maintain it? I have already explained in earlier class. For you, those who are new, why it is essential to maintain the pH at 7.4? You have to find out the answer. You have heard the Rollo formation. RBCs are stacked. These RBCs are stacked. When these RBCs are stacked, the size of this stack, Rollo, is much more, then it will exert viscosity and it will reduce the flow. Blood will be more viscous if any rouleau formation is there. Why does rouleau actually this is formed? This is when fibrinogen level is increased, it will facilitate formation of rouleau and thereby it will hinder my circulation of blood through the vessels. Okay? If you take certain amount of blood in a tube, add some anticoagulants and place it vertically, after some time you will find the RBCs are coming down, settling down. It depends how fast this will be settling. It will be depending on fibrinogen, amount of fibrinogen present in blood. If it is high, settling will be faster. Okay, if I don't want it to be settled and there is increased level of fibrinogen, there will be increased sedimentation of RBCs. That's why we do ESR, erythrocytic sedimentation rate, because in various disease condition, ESR, erythrocytic sedimentation rate per unit of time, how much cells are separated? Ato millimeter per hour. This is the unit. So in that way, so we know if there is increase in fibrinogen, this will be increased. Now what happens? Actually, the RBCs are having negatively charge on their surfaces, and fibrinogen disturbs these charges. As a result, the RBCs cannot repel each other. They cannot remain in the suspension. So as they lost their charges, so they will be settling down. So so because of stability means stability of RBC to remain in suspension. This is important. If rouleau formation is there, so while passing, this rouleau will create resistance obstruction to flow. So that's why we don't want there should not be formation of any rouleau. Plasma protein also acts as, suppose you are fasting, you are unable to take any food, whatever, but your body has to produce insulin, it has to produce glucagon, it has to produce several enzymes. So many, protein has got so many functions. The functions has to be done. Now, I am not ingesting protein. What will happen? This plasma protein will be taken up by the permeability. Normally, these are not allowed to pass. But in the capillary now, in this condition, permeability will increase. As it is a smaller, like albumin, they will be passing. And the macrophage present in the ECF, they will engulf this protein, destroy it, amino acid will liberate, and again they will shift this amino acid to the blood, and when they will be passing to my pancreas, now the pancreas will synthesize from these amino acids its required hormone. See, means it will produce insulin, glucagon, like that. It will produce somatotropin or ACTase or LAs, FSH. These are or whatever enzymes. The salivary enzyme stalin is made up of protein only. So whatever enzymes has liberated, it will not be coming back. So daily it has to be synthesized. Similarly, hemoglobin. I have to synthesize hemoglobin. Okay. So in that way, this plasma protein also acts as reserve. So under such condition, crisis condition, they will be used as nutrient. Clear? You know it well. Who is the responsible? Who is responsible? What are the constituents responsible for body defense? Among the cells, WBCs. Okay. And among the plasma proteins, gamma globulins. Particularly gamma, it has got variants. IgG, IgM, what are these? Immunoglobulins. These are actually globulins. So different varieties of immunoglobulins that will be discussed later during our immunity class. So that's why body defense, for body defense mechanism, it is very essential. When liver is damaged, liver cell, say in hepatitis, infective hepatitis, viral hepatitis, actually liver cells are damaged. And liver cells are having a lot of enzymes. And these LDAs, ALT, AST, SGPT, SGOT, these are the liver enzymes. So what will happen, since these are damaged, these will enter into the circulation, and in the blood plasma you may get this. Beside this, there are some other enzymes which help in different processes. Normally they remain in plasma. This is under abnormal condition they come out, but under normal condition also some enzymes are there. For example, thrombin, fibrinogen, they are actually enzyme, proenzymes. When the prothrombin is activated, this is converted into thrombin. Now thrombin acts as enzyme and starts coagulation process. And the fibrinogen also, when they are stimulated, they are converted by thrombin into fibrinogen, will be converted into fibrin. Now this fibrin is soluble. So there is another factor present in plasma, they make it solid and produces a network. Within this network, RBC's platelets are trapped and they make a solid structure, and this is clot. This is clot. So some enzymes remain present, also remain. Besides this, there are some other enzymes present in plasma proteins. And you in the blood, through blood, some proteins as hormone are passing through. So as we told, the blood plasma contains other organic substance. Among other organic substance, there are so many things. So there are hormones, different hormones are also there. Role of plasma proteins already discussed. See, whatever there is a tear, so blood cells are coming out. Okay, these are the platelets. So they become the endothelial cell, the blood vessels. So endothelial cells and the collagen, the outermost layer, they contain collagen. When the platelets come in contact with the collagen, it ruptured, and the process of initiation starts. Initiation of what? Coagulation mechanism. Initially what will happen? This collagen will attract platelets, and these platelets will be activated. This activated will influence other platelets to adhere with them. As a result, what will happen? A platelet plug will be formed here. So this is the first mechanism. Before clotting it takes place. Before clotting is completed, mechanism of clotting is completed. Before that, it happens. This is called hemostasis. Two terms I told. There are two terms, homeostasis and hemostasis. This is hemostasis. What is homeostasis? I will discuss it in a single class will be there. Within that class it will be explained. This is the controlling mechanism to keep all the functions of our body in a constant level. Yeah, my body temperature is not changing. My blood pressure is not changing. How these are maintained? So these are the mechanism. There are positive mechanisms, negative mechanism. This will be explained. So damaged blood vessels, release of thromboplastin, calcium ion, stimulates prothrombin into thrombin, thrombin converts fibrinogen into fibrin. Now it produces a network, and within this network, blood cells are collected and clot is formed. And after some time, Again it retracts and some fluid comes out, and this fluid is called what? A straw colored fluid comes out of serum. So this serum is different from plasma because all this serum, it is not having any clotting factors. No fibrinogen, no prothrombin. So this is the difference. The components required in the process of coagulation, these components will not be present in serum. These are the factors. While I will be discussing mechanism of blood coagulation, so you have to remember these factors. Factor 1, 2, factor 13. So how these are involved. Actually, this process of coagulation is like a waterfall. One after another. One stimulates this one, this will stimulate this one, or we will call it what? Cascade. Cascade of events. It is explained that way. There are two pathways, intrinsic pathway and extrinsic pathway. So these are the pathways. Intrinsic pathway, this is extrinsic pathway, this is the intrinsic pathway, and finally clot is formed. And these you have to learn later. And see, this is also it has got diagnostic value as a ratio. When your doctor advises for liver function test, so actually what is provided in the report? What is the total protein content? What is the globulin content? What is the ratio of these? In this way, different plasma proteins level are given. So with that, in different disease condition, these are changed. So whether these are changed to confirm your diagnosis, so these are of immense value. Whipple's experiment. What happened? One scientist, Whipple, he wanted to know where from this plasma protein comes. What is the source of this plasma protein? So what he did, he took a dog, take out certain amount of blood, then centrifuged it, separated the cells and plasma. And this plasma will contain plasma protein. He threw it out. And the cells, he dissolved it in Ringerlock solution like saline. So same amount, the amount of plasma discarded, same amount of the solution is taken, and within this solution the cells are suspended. Then they are injected back. So he repeated this procedure. This procedure is called plasmapheresis. So what is this procedure? Take out certain amount of blood, separate the plasma, throw it out, again reinfuse the cells through Ringerlock solution. Okay, so this process, if you repeat, what will happen? Plasma protein concentration of the dog will be reduced. And he saw when the plasma protein level is reducing, immediately within few hours, level is rising. That means somebody is providing this. So if you continue this process, after some time, the source will be finished. So there will not be no addition of new plasma proteins. And after that, when the plasma protein level bring down to 4 gram per cent, and even after that, if you reduce, the dog goes to shock and dies. So this is very important. When plasma protein level is falling, so it is alarming to us. It has to be maintained because all these plasma proteins are functioning so many jobs. If you know the functions of this, if plasma protein levels are reduced, So you can think what may happen in your body since you know the functions of all the constituents. Okay? So you have to be in analytic mind. Hypoproteinemia, decrease in COP, colloidal osmotic pressure, it will lead to increased filtration of arterial end and decreased absorption of venous end. Why? Hypoproteinemia. Hypoproteinemia, less plasma protein concentration. So this will lead to accumulation of fluid and this is called edema. Now this was the initial important part, clinical aspect. So I will be discussing it with HDL plus.